Hello everyone, once again welcome to my OET channel. Today I came with another one OET speaking card presentation. So this is latest exam role play card in 2024. So before proceeding to the role play card, I would like to tell you something about my OET online academy. So we have some tutors, those who are expert in teaching, and we are providing 1:1 basis OET module training in all modules: writing, speaking, reading, and listening. So I know that so many students are still struggling with listening and reading, like especially writing and speaking. At least you can keep on practicing with the materials which is available in social media, but listening and reading is somewhat tough, that someone should be there back of you to guide you. So we are providing 1:1 basis training according to your timing. So it is flexible time, there is no time period limitations, and I know that most of you are working and you are with family and you will have more problems to handle when you are in a study period of OET. So here is the thing, that we will provide you the tutors as well as a time setup, like a relaxed time period. Example, if you have 2 months or 3 months for your booked exam date, so you can set time with your tutor once if we enroll with our classes. So we will allot you specific tutors for each module, and you can talk with them, and according to your convenience as well as tutors convenience, you can fix the schedule for the classes so that you can relax and you can do all the modules. And it is very difficult to concentrate on all four modules, especially if you are working and if you are stay with the family. So you can set a timetable with your tutor and you can practice by your own way. So always try to finish your classes at least 2 weeks before your exam date. You can schedule according to that so that you can have a self-study. It will be much helpful if you do self-study, example 2 weeks before your exam time. Okay, so we are we are providing materials as well as, so I have some recent exam question papers for writing and speaking, which one I have collected by myself from the social media and from some of my students. And for listening and reading, actually we have some authentic materials, so it will be helpful for you to practice in a very well manner. So if anyone wants to join with my academy, I have given the contact number below in this video, and you can see it even in the description box, and you can WhatsApp, or else you can just drop a message over here in YouTube and I will give you the guidance. So we will go to the role play. Here come our role play card. Actually, this is the latest exam question in 2024. The role is, you are dealing with 43-year-old patient who is recovering from abscess and is now being discharged from the hospital. You are working in the hospital ward. You are here to provide discharge instructions, and the patient is concerned about continuing antibiotic treatment. So this is a quite like what we can tell, we can expect this type of question paper in every question, every exam, because it is a discharge explanation. So discharge explanation means you have to explain many things. So sometimes you may get very small question paper, sometimes the role play card will be very large, there will be more subdivisions, and the time will be very limited, 5 minutes. So it is a challenging situation how you will finish your task within this time. So what you have to do during 5 minutes preparation, sorry, the 3 minutes preparation time, so you have to read in a quick way first. Then the second reading part, when you read, you can just underline, okay, maximum you can underline the important points, so it will be easy for you to present during the 5 minutes presentation time without any difficulties or without any gap. So what you have to do, first you can think about, or you have to imagine that you are in the hospital ward and you are approaching a patient. So now what is the important thing, in this scenario, you know already the resident, or you know already the patient. That means you're working in the hospital ward and the patient already got admitted and now is being discharged. So what you have to do during 3 minutes preparation time, you have to ask patient's name and write it over there in your paper, okay, in a caps lock. That's a tip. Actually, if you are talking with a parent and a patient is there, means you can write the parent name in caps lock and the patient name is small letters, because you are talking to the parent, not to the baby. So that is one tip over here, in overall role play cards. Then second one, you have to think about the thing. I mean, it's not a nod case, the real nod case. That means you didn't start a conversation, you are approaching the patient, so you have to introduce yourself. The first task, UNC confirm his or her readiness for discharge, satisfactory recovery, explain the reason for seeing the patient, discuss post-discharge care, find out how the patient is feeling. So the important thing is task, not the task. You have to underline the task. That is a confirm the readiness for discharge. So how we can start a conversation? So you asked already the name. Example, the patient's name is George. So you can start like this. Good morning, George. I'm Rishmi, one of the staff nurses working in this hospital ward. How are you doing? So that's enough for the introduction. So the answer will be, I'm doing great, sister. Thank you. So, okay, then we can continue. Happy to know that you are good. Actually, I came here to explain you regarding your discharge, and your recovery is satisfactory and the doctor is planned for your discharge. Are you happy with that? Then the next thing is explain the reason for seeing the patient. That's a discuss post-discharge care. So you can tell that, actually, George, I would like to discuss you regarding the post-discharge care. How you're feeling about going home. So with that, we have finished the the task. The second task is outline post-discharge care, like wound care, diet, hydration, continue antibiotic treatment. So you can, like you already asked that, how you're feeling. So the answer will be, I'm happy to go to home, sister, but I'm concerned about the wound care and other management. I don't have any idea. So what we can tell, okay, George, I can truly understand your concern. No need to worry. I am here to explain you regarding the wound care, diet, hydration, as well as continuation of antibiotic treatment. Are you okay to hear, or are you okay to listen? Then the next task is stress the management at home, like check the signs of infection, follow up appointment. So you can tell that along with that, I would like to tell you what are the things you have to check or monitor at home, especially the signs of infection, and you have follow up appointments. I will provide you all details at the end of the conversation. Is it okay for you? So that's enough. Then explain the importance of antibiotic treatment, prevent spreading, recurrence of infection, recovery, and find out any specific concern or question. And so you can just ask, do you have any concern, or are you following me? Are you getting my point? Still you look anxious. Is there anything to be worried? So these sympathetic words or phrases you can use in between the conversation. Okay, so it should be an active dialogue. It's not a monologue. It should be from both directions. The conversation should be equally important in both directions. So you can ask like this. Do you have any concern? Maybe you can ask. So the answer will be, you mentioned that, maybe the question, you mentioned that the antibiotic, but then I need to continue at home. And then the answer will be, yes, George, of course, because the antibiotic treatment, it is very much important for you in this condition, because it's to prevent the spreading or recurrence of infection, because already you are recovering from abscess, isn't it? So you are in recovery stage. So it is so much important to continue your antibiotic treatment. Maybe you can ask another one more question. Find out any specific concern or question can be asked in this way. I can sense that you are a little bit anxious about something. May I know, so that I can clarify your doubt? In that way also we can ask. So the question will be, the next task we can see, then we will come to know about the question. Emphasize no concern about side effects. No side effects so far, easily manageable if occur, etc. Give details of possible side effects like stomach upset, sleep disturbances. So from this sentence, we came to know that patient is concerned about the side effects of antibiotic therapy. So we asked already that I can sense that you have some problem or you have some concern. The question will be, yes, sister, actually I have some concern about the side effects of antibiotic therapy. So we can answer like this. It's a quite natural question from your side, George. No need to worry. I can explain you. Actually, there is no side effect so far with this particular antibiotic, because we have started already the IV antibiotic for you, and at home you can continue with the oral antibiotic, the same medication. And in case if there is any side effects occur, it most probably it will be stomach upset or sleep disturbances, and it can be managed very easily with the home remedies. So no need to worry about the side effects of the antibiotic. So are you okay with that? The answer will be it's okay, fine. So the next task is warn about not taking antibiotic, worsening infection, need for invasive procedure, complications, etc., and establish willingness to continue antibiotic treatment. So warn, you have to underline with the reading this warn or resist. If you have seen warn or resist, that means there will be something opposite of your conversations happen from patient side, so you have to warn against that. Always if you see warn or resist, you have to ask, do you have any concern, all right, or do you have any more question, or you still look anxious, is there anything to be worried? So something you have to ask there. Okay, don't go to the straight to the sentence. You can ask, George, I hope you have understood everything. Still, do you have any concern, or still are you worrying about anything? So the answer will be, yes, sister. Actually, I'm a little bit concerned again regarding the same antibiotic. I'm wondering if I didn't take the antibiotic, if there is anything will happen, because I know that I'm recovering and there's no more abscess there over there, and I don't have pain currently. So what we can tell. George, as I informed you, I can truly understand your concern, but I would like to tell you that in case if you didn't continue the antibiotic therapy, there is a possibility of worsening of your infection, or there is a need for an invasive procedure such as opening the wound and to drain the pus or something like that. And there will be some more complications can occur, but no need to worry. As I advised, if you continue your antibiotic therapy at home for a particular time period as doctor prescribed, everything will be all right, and you can get rid from every infection. How does that sound? Are you okay with that? Like that we can ask. So always if you want to want something or resist something, don't straight away don't tell that you should or you should not. Okay, so you have to tell that I'm really sorry to tell you that. That is the exact phrase. I'm really sorry to tell you that if you didn't complete your antibiotic course, there is a chance for worsening of infection or need for invasive procedure, or even there will be more complication then. But no need to worry. Don't forget to use the term. But no need to worry. If you continue your antibiotic therapy as our advice, everything will be all right, and you can avoid further complications. Are you okay with that? How does that sound? So whatever you want, you can ask. So with that we can conclude, and we can ask, George, I hope I have clarified all your doubt. Is there anything to be clarified still? So the answer will be, no sister, I understood everything, it's okay, fine. So the last task is, so if you don't have any other question, are you okay to continue your antibiotic treatment at home? So that is a confirmation. Yeah, of course, I will continue. Then we can tell that, okay, George, well, thank you for accepting my advice, and I will provide you the discharge pack, so that you will get complete information about your management, the medications, the wound care, your follow-up appointments, everything. And if you don't have any other question, may I proceed with your discharge process? So that will be the last sentence. Okay, so in every discharge discussion, the last sentence will be, may I proceed with your discharge process? All right. So with that, we can wind up the role play. So this is the way how you have to practice during your pre-exam time, and you have to talk with someone. Example, if you talk same like in this way by yourself, there will not be any benefit. You have to speak, you have to talk with someone through the phone, or if you have friends, like you can sit together and you can practice each other, so it will give you more effect than practicing by yourself. So other 3 modules you can do by yourself, but speaking you have to do with someone, especially with a paper. I know that if you are in European countries or in Middle East, it is difficult to take printout, but still I will advise you to take printouts. If you have at least 10, like minimum 10 role play paper, it will be much beneficial than if you are doing 100 role plays in your phone, because many benefits are there. You can mark over there, you can put tick mark whenever you will finish the task or subtask. You can write your patient's name or the parent's name over there, so that you will not get confusion. And if it is non-case, whenever you will ask the patient's name, then and there, if you write the name, and you can just note that it is a non-case, you will not forget the introduction part. So there is more benefit sometimes if it is a non-case, and if you prepare everything during 3 minutes preparation time, and once the interlocutor tell you to start a conversation, you will forget everything and you will start like, good morning, my name is so and so on. That means it's a wrong thing, because in non-case you will not introduce yourself. And the same way, discharge role play. In discharge role play, you can just write in the last task, nearby the last task, may I proceed with the discharge process. So everything will be planned during the 3 minutes preparation time, so that you will not get any interaction during the presentation, and it will go like a flow. So you should not stuck in between, you should not have a long gap. Humming is normal, everybody have humming, it's not a matter, it will not affect your mark as well, but there should not be long gap when you are presenting. And for everyone, the interlocutor will be different. Sometimes they will be more cooperative, sometimes they will be reluctant to give more information, sometimes they will sit simply like nothing, they don't know. Maybe the way of the presentation from the opposite side, it will not be favorable for you. Sometimes it will be more like encouraging one, so you cannot expect how will be the situation during your exam. So you have to be the leading part always, whatever the interlocutor. So even if it is positive or even if it is negative, you are the one is involving in this exam, and it will be purely depending upon your presentation. Okay, it will not be accountable for the interlocutor's conversation. So you could not tell that the interlocutor was not cooperative, so I couldn't perform well. It's nothing like that. You have to handle the situation, because if you're working in the hospital side, you can come to know that one day if you approach 10 people, the 10 patients also will be different in nature and talking. So the same way, you have to take everything like a practical way, and you have to think that every patients are different, every families are different, every parents are different when you are doing the role play cards. Okay, so you have to control your own flow, and you have to take over all the control of the sentence construction. That is the starting, you are the one should start the conversation, you are the one should end the conversation, but don't forget to involve the patients in between. That's the thing I told you. You can ask, do you have any concern? Still you look worried. Is there anything to be clarified? So these phrases and all you have to use in between the conversation, not every after sentences, but in between you have to ask 2 or 3 times, so they will actively participate in the conversation, or else they will tell yes or no. That's all. So it will not be active participation. Okay, so these are all the things you have to keep it in your mind whenever you are doing the role play. So I hope this video is beneficial for you. And once again, I would like to remind you regarding our online academy. If anyone wants to join, or if you want to get some more information, you can just contact with this WhatsApp number. And if you want to get our Ultimate Pro guide for writing or speaking, you can WhatsApp as well. So this guide contains 100 recent exam questions and answers, and the speaking guide contains 100 recent exam role play cards and explanations, along with some general informations, more like tips and tricks to get your desired scores in OET. So we will see you with another informative video. Until then, bye, take care.